I'd like to introduce our next speaker. This session is Holistic Medicine, Effective Treatment with a Focus on Nutrition, which I think if you've been to other sessions so far in our conferences, you're starting to realize that nutrition can play a huge role with our children. So today we have with us Dr. Debbie Hamilton. Dr. Hamilton actually practices in Boulder County and is actually my daughter's physician, and I'm very grateful that she's with us today. So for those of you here in Colorado, you know that we have a local right here with us. Dr. Hamilton is a board-certified pediatrician and physician nutrition specialist who owns Holistic Pediatric Consulting, a pediatric practice in Boulder, Colorado that offers comprehensive health care for children. The focus of Holistic Pediatric Consulting is in the treatment of children with chronic medical conditions such as autism, ADHD, emotional issues, digestion problems, allergies, and nutrition and growth disorders. Dr. Hamilton's career began as a general pediatrician in Rhode Island after residency training at Brown University's Hasbro Children's Hospital. This was followed by a fellowship training in pediatric nutrition at the Children's Hospital in Denver. From there, she went on to receive her Master's of Science degree in Public Health at the University of Colorado Health Sciences Center. She's certified in integrative holistic medicine. Her training in integrative medicine includes training as a medical aromatherapy specialist, biomedical treatment for children on the autism spectrum, and general integrative medicine through the American Holistic Medical Association. For the past 5 years, Dr. Hamilton has been researching her book called A Mother's First Gift, which focuses on helping women beginning before pregnancy to have the best chance of having a healthy baby. So please welcome Dr. Debbie Hamilton.
Thank you very much. I'm glad everyone's here today. I appreciate that. So I'm going to start just with some learning objectives, what I hope to accomplish with this talk. I want to explain a little bit about holistic practice and how it can be helpful for children with autism. I also want to discuss how, the basis of holistic medicine, how it focuses on nutrition and digestion, and why this is a critical foundation for everyone. I want to speak a little bit about some things about a healthy diet, including what to eat, but just as most importantly is what not to eat. I'm also going to discuss some of the different diets that people hear about, why you'd use one over the other, like who would benefit, and what kind of the risks if you do undertake this diet. So in terms of definitions, there are many different definitions, and I tried to categorize some. So holistic and integrative, which is one of the things I consider my practice, I see that as the whole span of everything that you can offer in medicine, from nutrition to herbs, to acupuncture, to prescription medicines and more traditional medicines. I don't like the terms alternative and complementary because that seems, outside of what you consider normal. And I have problems thinking that nutrition is actually alternative of anything. And then biomedical is a term that came through the autism community. In adult medicine, functional medicine is often discussed. For those, biomedical and functional, they're looking at the cause of disease. So instead of, say a child has stomach pain, instead of just giving them an antacid, you're trying to discover why they have a stomach pain. What's the cause of it? And then by understanding the cause, then you can go from treatment for there. There is an organization that's been started in the last several months. It's called MAPS, or Medical Academy of Pediatric Special Needs, and that's the website. Basically what they're trying to do is, for children with special needs, is to educate practitioners and to have a guaranteed level of education. So if as a parent you're trying to find a practitioner for your child, you know that that practitioner's had a certain amount of education and eventually board certification. So chronic medical illnesses in autism, I think everyone here knows this is not just a behavioral illness, but these children are sick. So in terms of the chronic medical illnesses, seizures, there's been a whole discussion on seizures, but around a third of the children have seizures. Learning disorders, everything from attention issues to dyslexia to sensory processing issues. Anxiety, a lot of mood issues. I always think if the world, you have problems communicating, and the world is nothing seems like it makes sense to you, then that's going to be very anxiety provoking. So just going to school can cause a lot of kids anxiety. A lot of allergic issues, things like eczema, allergies, seasonal allergies, food allergies, growth issues. I'm talking about a lot about nutrition issues, but if there's nutrition issues, often there's problems with growth. Asthma, again, being allergic type of breathing disorder. Infections, everything from viral infections, yeast infections, bacterial infections, immune deficiencies, whether a weak immune system, so they get a lot of infections, and in the same child, they also might have a lot of allergies. And then digestive issues. So what ailment do 70% of kids with autism have? And that's digestive problems. And parents who have children with autism have known for years and have been saying for years, well, my child has all these digestive problems and pain. And it took until 2 years ago where some general pediatricians and some pediatric gastroenterologists had a consensus report that actually stated what parents knew. But they did come with a number that's 70%, so that's a significant number. Okay, so what digestion problems do they have? It really ranges pretty much anything. Everything from reflux, gastritis, which is basically inflammation of the stomach, diarrhea, constipation, bloating, abdominal pain. Irritable bowel syndrome is basically a syndrome where you have almost all of the above symptoms. Inflammatory bowel disease, things like Crohn's disease and ulcerative colitis. So in this picture, I hope there's one thing that sticks out at you if you look at this child, and that's the bloated belly. And basically, you have a bloated belly, you're having swelling and inflammation in the intestines. And this is that can be very painful in terms of bloating. And so then why are digestive problems so prevalent in children with autism? Well, we know, and we're going to talk more about nutrition, but if you have poor nutrition, you're going to have weak systems from digestion to immune systems. As I said, there's a lot of immune problems. 70% of your immune system is actually in your digestive tract. So if you have immune problems, you have digestive problems. A lot of these children with immune problems will get a lot of infections. And again, when children are sick or they have infections, they don't eat. So that kind of contributes. So you can see this as kind of a cycle. When there are multiple infections, these children tend to be on a lot of antibiotics. Antibiotics will deplete the good bacteria, leading to further digestive problems. And then they have many allergies and sensitivities. If you're reacting to foods or things in your environment and you don't feel well, you're going to limit your diet. And anytime you limit your diet, you're going to have more risk of malnutrition. And why is poor nutrition so prevalent in autism? Well, there's a lot of sensory issues. So if you have sensory issues, then if you have food, you think about the food, it's like, how does the food taste? How does it look? Is it crunchy in texture? How does it smell? So you add all these, basically starts to limit the diet. Low muscle tone. A lot of children have low muscle tone. If you have low muscle tone, then even your cheeks are weak. So physically chewing can get tiring, especially things that are hard to chew like meat. And it also can be your muscle tone and then your tongue and then like your motor planning issues. It can make eating very difficult. Digestive problems contribute to nutrition problems. If you don't feel well, you're not going to eat if your stomach hurts. If you have malabsorption, then you're not breaking down your food. So even if you're eating the food, you're not getting the nutrition from the food. Fear of unfamiliar, so new foods are very scary, and food cravings. Some children, because of allergies and reactions, crave certain foods and they only eat those foods. And that again limits their diet. So people have heard this, you are what you eat. In holistic medicine, you are what you absorb. So even if you eat the best food in the world, if your body can't break it down and you don't absorb it, then you're really not getting all the good vitamins and protein and things like that. So again, with this, hopefully, it makes sense that holistic, integrative, biomedical, where I think I span all of those, the primary focus, like the real foundation of health, has to be good nutrition and good digestion. And hopefully everybody had a good lunch with good nutrition and now has good digestion. Potato chips. So healthy eating basics. I have all parents come in and say, how do I get my child to eat better, especially when they're toddlers? And there are some basic things that I learned in training and that have been shown in the research. You have to offer new food at least 10 to 15 times. So if you've offered it once, no, they don't like green beans, so you never offer it again. Maybe you have to offer it with sauce or oil, or maybe, at a different time of day. And these healthy eating basics apply mainly to neurotypical kids, and I'm going to talk a little bit why this is even more difficult with some children with autism. The other thing that often parents do if their child's not eating, or they're worried the child's eating, is start something called grazing. So they just start offering the food, and especially liquids, all the time. So I have these children who are constantly drinking a little bit, or constantly eating a little bit. But the problem is if they're always constantly eating a little bit, then they're never really hungry. Like they're never really developing a good appetite. And when they looked at how many calories a child gets if they're grazing all day, they actually end up getting less calories than if they have good meals. So I like to say 4 to 6 mini meals. If I say meals and snacks in the United States is junk food. But children eat a small amount, so every time you feed them, if you have a small amount of nutritious foods, if they don't eat that at that time, then there's only 2 to 3 hours before they have something else. So you don't have to try to force feed them like, okay, they're not going to starve. In a couple hours, I'm going to offer some nutritious foods again. I'm trying to avoid power struggles, especially when they're, toddlers. Instead of saying, do you want this? And they can say no. You can say, do you want the green beans or do you want the cauliflower? Offer choices. And ultimately, the parent decides what food to offer. So if you don't want them to ever have McDonald's and they're 3, then you don't buy McDonald's. But it's up to the child to decide what food to eat. So again, with children with autism, the feeding issues are that much more complicated, as we talked about. You have to treat the digestive problems. If you have a child who has a bloated belly, if they have stomach pain, they do not want to eat. It doesn't feel good to them. They have negative associations with food. You do need to remove the foods that are causing allergies and sensitivities. If they eat dairy and it causes them stomach pain, then they're going to get a negative association and they're not going to eat. Zinc supplement, we'll talk more about this. But zinc, which tends to be low in many Americans' diets, but very low in many children with autism, is really important for appetite and taste. So if your zinc is low, you don't even have as much interest in food. And I definitely have parents who say, he just doesn't have any appetite, like they don't care. It's not important to them. And then I do think feeding therapy can be very helpful, especially with a lot of the sensory issues. So foundations of a healthy diet, organic foods are one of the top things. There are more and more articles about pesticides and neural development. Everything from when they measure the metabolites of pesticides in children with ADHD, that increase ADHD symptoms associated with the metabolites of pesticides. And to even, there's been more and more studies where if pregnant women are exposed to pesticides when they're pregnant, that their children have more problems with attention and nervous system development. So this is a critical point. Organic foods are getting more accessible. There is the cost. There's something called Environmental Working Group, which has a website that lists the foods, fruits and vegetables with the most pesticides, and those are the least. So if you can't do all organic foods, at least you can prioritize, get rid of the ones that are the worst offenders. So whole foods, anything of whole food is not processed, a balance of protein, fat, and carbohydrates. Our country goes through stages where they say one type of food is bad. Like for a long time, low fat was bad, and now there's a lot of low carbohydrates supposedly bad. But we have growing children, and they all have different roles, so it's important to have all of them. I'm a big fan of protein and fat, especially healthy fats at each meal, especially breakfast. The essential fats, which I'll talk more about, the omega-3s in fish oils or cod liver oil, EPA and DHA. You do want to decrease the simple sugars and simple carbohydrates. Obviously, fruits and vegetables are really good, and then filtered water. So anything like with the organic foods with the pesticides or filtered water with things like chlorine, any environmental toxic exposure that you can remove, that you can control, is good. You're basically just letting the system heal better, letting the body heal better. Basic supplements, I look at diet records, and there are some basic things that seem to be missing even in very good diets. One of those, I say, cod liver oil is omega-3s. Even if you eat a lot of fish, it's really hard to have a good, adequate amount of omega-3s. And if you eat a lot of fish, you have to worry about toxins such as mercury. I like cod liver oil because it has vitamin A and vitamin D in it in fat-soluble forms, which are very absorbable. I do think a good multivitamin with minerals, but especially trace minerals. Trace minerals are minerals that we need in very small amounts, like trace amounts, as opposed to calcium. And as our soils get more and more depleted for minerals, our food has less of these minerals. And these are important for everything from blood sugar to detoxification to mood. Probiotics is a third kind of basic if I have to think of three really important ones. We have antibiotics. People take them as medicines. There's also a lot of antibiotics in our food and in our vaccines, so we're all exposed. So we need to have some way to get back the good bacteria. Fermented foods are very good, and some people do their own fermented foods, kefirs, but otherwise, regular probiotics are also good. So summary of foods to avoid, and you look at this list, there are no organic foods and there are no whole foods. So these are all things that are actually made in manufacturers. So genetically modified foods, basically proteins are put into our foods. So proteins, we're changing the genetic material of the food, and so we wonder when we take that food, what is that going to do to us? There's whole conferences about genetically modified foods and their dangers. Artificial sweeteners, things like sucralose and aspartame, both of those were actually discovered accidentally. They were looking for insecticides and realized they're actually sweet. So they act like excitatory neurotransmitters in the brain. So they're causing the brain to overreact. And they act very similar to MSG or monosodium glutamate. So it's basically they're constantly the brain's going over and over and over again. High fructose corn syrup, again, this is not a natural food. And the body doesn't really know exactly how to metabolize this. So it puts an extra strain on your liver, causing things like fatty liver. Many people also concerned that it's increasing all our rates of obesity and diabetes in this country. Trans fats are, again, artificial fats. Those are the worst in terms of heart disease, but they also compete with omega-3s and good fats for being put into our brain cells and the nerve, the fatty layer that goes around our nerves. Food dyes and food preservatives, again, these are two things that kids tend to react to very frequently in terms of sensitivities and allergies. You see a lot of hyperactive behavior, mood behavior. And again, there's nothing beneficial in any of these foods. So I'm going to go and I'm going to do kind of go through a little bit of a diet history. So for every family that comes in, they write everything that this child eats for 3 days, eats and drinks for 3 days. And if you look at this one, and I illustrate this one because it's like Cheetos, Cheerios, cookies, pretzels, even for dinner, pretty much breakfast, lunch, and dinner. So I think it's pretty easy to see that there's a lot of things missing from this. And I illustrated on the side there, if you can't read it. So everything they write goes onto a computer program. And I get a summary, like an average of what this child is eating every day. And on the bottom, outlined in yellow, is EPA and DHA. And those are the omega-3 fats. And if you look right next to them, basically the level is essentially 0. And on the side, where goal, I kind of write what I want it to be, or kind of where we're trying to aim in terms of this. So why are the essential fats so important? Well, we're building a brain. The brain is approximately 60% fat, and we have a growing, developing brain. So kids need fats. They need good fats, but they need all fats. So there's been a lot of studies on omega-3 fats. Now this study looked at 411 typically developing children, so neurotypical children, and they just measured they took cheek cells and measured the amount of omega-3s in those cheek cells. So again, this is neurotypical children. But even with those children, the higher the omega-3 fat levels was actually associated with better mood and better behavior. So these are important just for all of us. In terms of children with autism, both of these studies supplemented children with omega-3s, and they saw a lot of improvements, especially in hyperactivity and mood stabilization, which it seems like over and over, a lot of the studies, that's what they show in terms of positive effects. So this is an interesting study because it looked at something called verbal apraxia. which is a speech issue, but like a motor planning speech problem. And they looked at EPA and DHA, but they also looked at GLA, which is an omega-6, so a different type of good fat, and vitamin E, which is an antioxidant. And all of these are low in children with autism. And the results show that there was multiple good effects, everything from improvements in speech to coordination, eye contact, sensory issues, and pain. So I'm going to kind of throw some different clinical things in, just some different signs that you can look at. And this is the chicken skin, you know, the bumps on the back of the arms. Some people have them also on their thighs or their cheeks. And this is a sign that helps you know that there's low vitamin A and essential fatty acid deficiency. And it's also good because if you supplement and you're starting to see improvements in behavior and improvements in the skin, you know, it helps to know that you're helping your child. Cholesterol, in adult medicine, cholesterol is considered a negative, bad thing. And what we do, we spend a lot of time and money trying to lower cholesterol. But there's a lot of very important functions of cholesterol. And so again, the brain is 60% fat, and cholesterol is actually a part of that. So it's essential for basically steroid production, so basically hormone production, but also helpful in terms of something called GABA, which is a neurotransmitter. GABA is a calming neurotransmitter. So here cholesterol is helping with one of the calming neurotransmitters. It's also important for myelin membranes, so the fat around nerve cells to help nerve transmission. It's also important for development, embryonic and fetal development, so very important for pregnant women. It helps modulate the oxytocin receptor. And the oxytocin is the bonding hormone. So in the biomedical community, we actually prescribe and recommend oxytocin for children with autism because it helps the socialization. So here we have something that cholesterol is actually really important for. And it's also important for serotonin. So there's a lot of calming and bonding hormones that are really critical with cholesterol. So the reason that I'm talking about cholesterol in terms of autism is because a study was looking for something. There's a syndrome called Smith-Lemli-Opitz syndrome, which is a genetic syndrome where the children present with the same symptoms as autism. It is actually from the body has a problem breaking down a precursor cholesterol. So the cholesterol levels are very, very low, like below 100. So somebody was studying, looking for this syndrome, and took families where 2 or more children have autism, and they tested the cholesterol. And although they didn't find a lot of this syndrome, what they did find was a lot of children with autism have very low cholesterols. So I said, cholesterol is very important, and we actually now, because of this, actually can supplement children with with cholesterol. Okay, so this goes back to the diet record again, but this time we're looking at the bottom where in the yellow it says sugar. So every 4 to 5 grams of sugar is 1 teaspoon of sugar. So you can calculate how many teaspoons a day. But this child is getting 18 teaspoons a day. I've seen kids get twice as much, and basically you'd probably want half of that. And it's actually very more difficult to do. Sugar hides in many, many places. So this is the child, this is not the real patient, but you look at him, he's holding a cupcake, and he doesn't look very happy. And that's to show, in terms of if you're having a lot of sugar, a lot of carbohydrates, that's your mood. You see a lot of problems with mood going up and down, like the blood sugar roller coaster. If we have sugar, you get hyper. The sugar starts, your body's like, this is not good. We try to bring the sugar down, get tired, your blood sugar goes low, you get cranky, and then you want more sugar to bring it back up. So health problems from sugar, as I said, it does trigger negative effects on mood and behavior. It also, I call sugar negative nutrition. It actually depletes nutrition. Your body actually has to use minerals and things to process the sugar. It encourages the overgrowth of yeast and harmful bacteria in the intestine. It's an immune suppressant, and it also increases inflammation. Now, when I look at all of those health problems from sugar, if I'm treating a child with autism, I'm trying to improve mood, I'm trying to improve nutrition, I'm trying to decrease yeast, I'm trying to improve the immune system and decrease inflammation. So basically, sugar is undoing everything that I'm trying to do. So here, this is basically all the different vitamins. And if you look under goal, you can see from that diet, and this is going back to the diet that we saw before, but pretty much low on almost all of the different vitamins. And these are the minerals. And so again, look under goal, very low in all the minerals. And if you look at the very bottom, selenium, chromium, and molybdenum, and I write trace minerals, because those are an example of the trace minerals. Minerals we need in very small amounts. And basically, he had none. So basically 0. So here's another picture. And when I look at a child, part of the exam is to look at their skin, and there's a lot of good hints on the skin. And basically, these are like white horizontal lines on the nails. And usually most people start looking now at their nails to see. But this is a sign of zinc deficiency. And not everyone with zinc deficiency will have these, but I actually do see this quite frequently. So why is zinc important? Well, we talked a little bit that zinc is important for appetite and for taste. It's actually really important for growth. And I talked about the white marks on the fingers. It's also really important for immune system function. It's also important in terms of vitamin A. Everybody knows vitamin A is good for vision. But if you don't have zinc, then the vitamin A can't do what it needs to do. So you see more visual defects. It's also something that I call, it's very important in terms of mental processing and cognition. So I learned a long time ago, no zinc, no think, as a way to kind of get the idea how this can help, and then memory and mood. So now I'm going to go into some studies in terms of no zinc, no think. So this is a study that looked really just to show 230 children on the autism spectrum, and they basically measured plasma zinc and copper. And they found on average the zinc was lower, and average the copper is higher. And then basically the ratio is the same. But I said, we know how important zinc is. We also know that copper in high levels can be toxic too. It can actually act like aluminum in terms of hurting, mental processing. So another no zinc, no think. This study actually looked at zinc and iron and found in children who was low in both. Now, zinc and iron are both in animal products, especially meats, so they tend to travel together. If one's low, often the other one's low. And they supplemented these children with both iron and zinc. And actually, I always look at zinc 5 milligrams a day because it's actually a pretty low level of zinc if you're supplementing. But these children did show improvements in verbal and nonverbal memory. And a lot of this is to show you that, like how nutrition really plays into how are you functioning. We're feeding the brain, we're feeding the body, and so it can function the right way. I call this one no zinc, no magnesium, no fish oil, no think, just to say, it's not just zinc that's important. And this looked at 810 children with attention and behavior issues, and they supplemented EPA and DHA, our omega-3s, GLA, which is omega-6, magnesium, and 80 milligrams, which is actually a relatively low dose, and then zinc. And they did show improvements on attention, behavior, and mood, and emotional issues. So what about magnesium? So after zinc, magnesium is probably the second mineral that tends to be low, and not just in children with autism, but in the United States. And if you look at these signs of magnesium deficiency, and I'm sure that you might recognize some of your own children or your spouses, or irritability, restlessness, muscle tightness, sleep problems, constipation, headaches, and sensory issues. So magnesium, if I do have a child with constipation, it's my first line of therapy. It's also really helpful for sleep problems, especially at night, right before they go to bed. And what about iron? Iron is often low, but iron is a little more tricky because iron can promote inflammation. It also can make it more difficult to get rid of bacteria and imbalance in the intestines. But in terms of ADHD, there's some more recent information. And they looked at 23 children. And non-anemic means that when they looked at their blood count, it was normal. They didn't show any anemia in the blood count. They had to look at something called ferritin, which is an iron-binding protein, which is what I measure, because ferritin will show that the iron's low before the blood count does. And so their level, when they seen the children were below 30, they had more problems with attention. And by supplementing with iron, that this improves in the attention. Iron's also really helpful for sleep, so those children who don't sleep, who have restless legs, measuring ferritin and iron. But again, you don't want to supplement unless you really know what the levels are. So additional supplements for autism, we talked about zinc and magnesium. With calcium, depending on diet, if a child is off of all dairy, usually you do need to supplement calcium. Again, calcium, magnesium at night is very calming and really helpful to promote sleep. I am a fan of, there's some very autism-specific multivitamins that kind of combine all the different things that children tend to be low in and try to make things easier by putting them together. B12 and folic acid, but special forms are very important. Vitamin B6. Now, vitamin B6 was one of the first vitamins that was actually studied in children with autism, and then also vitamin D. And again, vitamin D is another one that tends to be low in a lot of people. Even in sunny Colorado, I find many people are low. So in terms of vitamin B12 deficiency, vitamin B12 and folic acid cause a different type of anemia, but they can lead to fatigue, definitely neurological problems. Neuropathy is kind of weakness in the lower nerves. It's also important for immune function and energy. Okay, in terms of folate and B12 work together in the body. So there's an overlap in some of the, if they're low. In terms of anemia, folate's really important for overturn of cells, like cell growth, DNA synthesis. So any tissue that has rapid turnover, like the gastrointestinal system, will have problems from folate deficiency, and then again, neurologic problems. Vitamin B6 deficiency, if I have a child with ADHD, B6 is one of the things I first think of. Hyperactivity, irritability, sensory issues, poor attention. You need vitamin B6 to make serotonin, which is a calming neurotransmitter. And B6 and magnesium actually work very well together, and I often give them together. In terms of vitamin D, most people know that vitamin D is important for bones. Basically, it's also the sunshine vitamin. The way that vitamin D plays in terms of bones is if you don't have vitamin D, you don't absorb your calcium. But it's also really important for the immune system. And people think about, well, when in the winter, when you have less vitamin D, those people get sick more. But not just in terms of infections, but also in terms of allergies and asthma. So in terms of basically helping the immune system, it's critical. Diffuse musculoskeletal pain can be from low vitamin D, definitely mood, seasonal affective disorder, poor sleep, and restlessness. Okay, so everybody's still awake after lunch? Okay, I'm going to go what I call the alphabet soup of ASD diets, because people hear all these acronyms, GF, CF, SCD. What do they mean, and why would I do one versus the other? So gluten-free, casein-free, which is a good one to start with. So gluten, as probably many of you know, if you've probably done this with your child or yourself, is like glue. It's the biggest protein in wheat, barley, rye, and spelt, and it helps bind things together. So wheat-free is not gluten-free. So something can say wheat-free and still have gluten, and it's the gluten that we're worried about. There's also, since gluten is like glue, it's used in a lot of processed foods, soups, because it's a binder. When I first learned about gluten-free, it always surprised me, so I always mention this, that soy sauce has gluten or wheat in it, because it just says soy sauce, but soy is actually soy and wheat. And you can get something called tamari, which is basically gluten-free tamari, which is just soy. Casein is the main protein in dairy. So if you're casein-free, you're avoiding all dairy products, so goat or cow, any kind of mammalian dairy product. And just like wheat-free is not gluten-free, dairy-free is not casein-free. So dairy-free is a term that came about for people who are lactose intolerant, who have problems with the milk sugar lactose. So you have to be careful of things that are like dairy-free cheese, because casein is a binder too. And so casein will actually be put in those products. And again, processed foods. So when do you try the gluten-free, casein-free? Again, any kind of digestive symptoms, and it doesn't matter what kind of digestive symptoms. It can be diarrhea, it can be constipation, any kind of irritable bowel syndrome pattern, any kind of allergy symptoms, whether it's eczema, the child who has a chronic runny nose, chronic itchy eyes, any kind of asthma or wheezing. A child who has chronic ear infections, which is also very common in children with autism to have multiple infections. If a child is craving wheat and dairy, that's actually a sign too that they might be reacting to these foods. Any child that's really agitated or hyperactive, or a child who's kind of spacey in their own world. And this is just a sample of, a picture of somebody with eczema, that dry, scaly, itchy rash. And it can be everywhere in the body, but it can be just in patches too. So what about the beneficial effects? The Autism Research Institute has been doing an ongoing parent survey to see, basically it's a survey of different biomedical treatments, but it surveyed to see if a parent does a gluten-free, casein-free diet with their child, they see about a 66% improvement. So I think that's actually pretty good. And they also, the below study looks at if they do a gluten-free, casein-free diet, does this actually help heal the digestive problems? And the study in the bottom has actually shown that it is beneficial. And so then I have parents ask me, well, how do I know if I should do this diet? Is there any way to test? Or I have parents come in and say, well, my doctor tested for wheat and dairy allergies and my child's not allergic. So I need to explain that there's different ways that you can react to foods. So the classic allergy, or if you do a skin test, is looking at an antibody in the blood called IgE. They're looking for immediate allergies. And this is the same kind of antibody that a child who has peanuts and their throat closes up. That's an IgE immediate allergy. Now this is showing you can also test in the blood something called IgG allergies, which are delayed reactions that are mediated through the intestinal system. And if you look up here, this is high wheat gliadin was high, wheat gluten, rye, spelt, and whole wheat. And again, this is actually going back to the child who's basically eating just wheat. So this is kind of one way you can look. The casein and the gluten, if your body can't break them down, the intermediate peptides can act like an opiate peptide, an opiate peptide being a drug. So this is part of the reason that some children actually crave the wheat and dairy. And you can measure this in a urine test. Now that being said, there are children who are positive on these tests who have okay reactions, and there are kids who are completely negative and you take them off gluten casein and they do remarkably well. So I always say that it's a really safe diet. The main concerns are it does have to be 100% to be effective. Some children are so sensitive that literally one bite can actually cause problems and you won't even know if the diet's effective. My problem with some of the gluten substitutes, a lot of them are low fiber. You're going from maybe a whole grain wheat to like a rice flour. So some of these substitutes are very simple carbohydrates, and so you can actually add a lot of sugar and then get a lot of mood problems that are actually from blood sugar issues. If you are dairy-free, you do need calcium. And one of the main concerns I also have with the dairy-free is dairy can be the primary protein in a lot of young children's diets. They're not eating a lot of meat, not eating a lot of beans. So if you suddenly take cow milk away and you substitute rice milk, you're taking something that hopefully it's a whole milk but has fat and protein, and then substituting with something that's basically pure sugar. So again, you can get a diet that's high in sugar. But as I said, in terms of if there's any other symptoms, probably the best thing to do is to be able to try the diet. I think it's very safe. Okay, so SCD is a specific carbohydrate diet. And although this diet has been known for a long time, it was actually brought back to our awareness by breaking the vicious cycle. And basically, a specific carbohydrate diet, it avoids disaccharides and polysaccharides. So di meaning two and poly meaning many. So basically, these are sugars that have multiple parts. And if you have intestinal problems and these sugars go in your intestine and you can't break them down, they basically are fermenting and sitting there and like feeding the bacteria and the yeast. So this is basically contributing. It's like giving all these organisms we want to get rid of, we're like feeding them basically. So this diet is a grain-free, lactose being the milk sugar, and sugar-free. So the GAPS diet, gut and psychology syndrome diet, is very similar to the SCD diet, but it very much makes a case of how, and this has also been made in some other things, about how what we eat affects our brain and behavior and the different chemicals that broke down. And I think Dr. Shaw explained that very well. Now, the GAPS diet is very similar to the specific carbohydrate diet in being that it's grain-free, lactose-free, and sugar-free. It also eliminates starchy vegetables or beans. It also does emphasize like bone broths and some kind of fermented foods and some nourishing foods, especially early in the diet, to help heal the intestine. So when would you try the SCD or the GAPS diet? So I'm thinking this is kind of the next step. Say you've done the gluten-free and casein-free, and the child still has chronic digestive issues, especially diarrhea. SCD is great for the kids who have like the chronic diarrhea, multiple stools a day. Any kind of intestinal inflammation, if you have a child with candida or bacterial overgrowth, and it's really not improving with treatment, Crohn's disease, ulcerative colitis, or inflammatory bowel diseases, or celiac disease. Now, there are some concerns, like with each diet, with the SCD or GAPS diet. So if you're getting rid of grains, you basically have meat, vegetables, and nuts and fruits. So a lot of children also have nut allergies. So this all very much limits the diet. In terms of these diets, a lot of people use almond flour instead of like wheat flour, and will make, cakes and muffins and things. It also tends to be a higher protein diet. So if there's more digestion problems, especially with proteins, it can lead to more higher ammonia or even kidney problems. Or actually not lead to kidney problems, but if you have kidney problems, you have to be careful. It's also high time commitment from food preparation. It's really hard to go out and get grain-free, sugar-free foods. And so like any diet, it takes a long time to, not a long time, but it takes a while for people to get used to how cooking, but it seems like a very diet-intensive, cooking-intensive diet. What about the low oxalate diet? Oxalates are organic acids, and actually the best way to measure oxalates is by urine organic acid test. And oxalates can be from diet. They can also be just from our normal metabolism, and they can also be formed by yeast and fungus. So the problem if the oxalates are high, and we see this in children with autism, it causes a lot of chronic pain. And so they found like people with fibromyalgia or other chronic pain syndrome sometimes have high oxalates. It's definitely seen also in yeast overgrowth. So again, the symptoms can be pain in the bones, the joints, blood vessels, kidneys, eyes. So in terms of low oxalate diet, basically these are a list of high oxalate foods. And I always know this because these are a lot of foods I like. So, and are very healthy. Look at greens, nuts and seeds, soy, grains, a lot of fruits, especially all the berries, vegetables, and then chocolate and tea. So when do you try the low oxalate diet? So here we've gone from, we've gone to the gluten-free, casein-free, we've gone through that. Then you think about the SCD or GAPS diet. If you've done those two diets and your child still has a lot of digestive symptoms, then it's time to think about the low oxalates. And again, looking at a urinary organic acid test is a good way to see if they are high oxalates. If you've gone through those other diets and they still have yeast and bacteria overgrowth, still have digestive problems. The child who has frequent urination or seems to have like bladder pain is one I also think about the low oxalate diets. The classic one is eye poking behavior. These kids who look like they're having pain in their eyes and literally trying to help the pain. Any kind of chronic pain or growth delay. How am I doing? I'm doing okay time-wise? So the concerns of the low oxalate diet, it does tend to limit many healthy foods. The main concern is people start adding on diets from diets, and you can get very restrictive. So say you're on an SCD diet, and you take away grains, and you only eat nuts, and then you're on a low oxalate diet, and you take away nuts, you can really kind of limit what children are eating. Because it does limit some fruits and vegetables, especially some greens and berries, it is a lower antioxidant diet, and you can also lower vitamin C. So the key points, I've been told I have a little more minutes. I'm actually almost done. So in terms of key points, you have to, I said, this is my foundation. This is where every child, child who comes in almost for anything to see me, you have to improve the nutrition. You have to improve the digestion. And if you improve the nutrition and the digestion, basically kids feel better. If they feel better, they behave better, they develop better, and they have a better response to therapies. It's much easier for a child to learn much more from speech therapy if they don't have a stomach pain. You know, they're going to do that. So this is an example of a healthy eating child. But that's it. I guess I have like 3 minutes for questions if anybody has a question. It's over there.
What is the dosages for like EPAs and EPAs? And I know that the usual standard on the bottles is very, very low.
It is very low.
So what do you recommend as far as the dosages for babies, toddlers, children?
Children. I mean, pretty safe for if you have cod liver oil, to have like 1 teaspoon of cod liver oil, excuse me, which is roughly 1,000 milligrams of omega-3s. A lot of the fish oils, if you have like 2 capsules, adult capsules would be 1,000 milligrams. That's kind of a good, safe, basic. For some things, you actually would double that, but I wouldn't double that without speaking with somebody, because you also need to, you don't want to balance omega-6s either.
Is there ever a problem with the E or the A?
The D or the A?
Because if you double or triple,
Right.
you get more A or E.
Well, cod liver oil is vitamin A and D, so I don't go more than 1 teaspoon of cod liver oil. If I want to increase the amount of DHA and EPA, I would add fish oil or another source, because you do not want to get too much vitamin A and D. They're fat-soluble vitamins, although they're probably much safer, especially vitamin D. We're learning more and more that we actually need a lot more than we actually think. So that answers. But 1 teaspoon of cod liver oil and then kind of go up with fish oils from there. Right, depending if you need to go more than like 1,000 milligrams. You go up in there.
So I was tested for gluten-free a while back.
Okay.
Is there any, does that mean I'm cool to eat wheat, or could it still negatively affect me?
So you tested positive for gluten-free?
No, I tested negative.
Okay. It depends if there's gluten-free. There's, as I said, there's many, many ways to test. And some people, if you go to traditional doctors, sometimes they test you for celiac disease with a blood test. And even if you come back negative on a celiac test, it doesn't mean that you can still tolerate wheat. So there are some stool tests that you can do that look at more than just different, more than just a traditional celiac test. Because basically there's celiac disease and there's people who are gluten intolerant. So sometimes the best thing to do is actually to try a gluten-free diet and see if you feel better in terms of symptoms. So that's, are we good? Okay, one more.
Does IgG testing require a food challenge, or can you do that when somebody's already withdrawn the food and then check?
If they've already withdrawn the food, it does not helpful, because you might have a negative test and they still have problems with the food. So usually you do need at least 3 or 4 weeks of taking the food on a regular basis before you could test. So, how about one more here and then there? Yep. The amount for zinc? I'm sorry, the dose for zinc? Okay. Actually, I think I'm supposed to be done, and I can talk with you after, if that's helpful. So, great. Well, thank you all for coming.